I think that was a great panel that Mary's story led to showcase some of the great things that are going on around the country, where there's been great progress, where there's some challenges, and we need to make more progress on. So now, I'm delighted to have the honor of introducing two-term Philadelphia Mayor Michael A. Nutter. Mayor Nutter is a hero for many Philadelphians by virtue of being a strong advocate for school reform and community policing, and a crusader for making his hometown the greenest in America. But for many of us in this room, he's been a hero for promoting healthier diets. He's worked to eliminate food deserts, often in conjunction with the Food Trust, a nonprofit group in Philadelphia. He helped get supermarkets and farmers markets into poor neighborhoods and helped corner stores sell healthier foods and beverages. He's launched a hard-hitting media campaign to raise awareness of the health effects of sugary drinks, and we saw an example of that from the previous session. And he campaigned hard for a stiff soda tax to reduce consumption. When the soft drink industry offered the city $10 million to drop the tax idea, Mayor Nutter summarily pulled a Nancy Reagan and just said no. Now, before all that, Mayor Nutter was educated at the Wharton School at the University of Pennsylvania. Subsequently, he served 15 years on the Philadelphia City Council. And when he was a council member, he testified at school board hearings to get sodas out of schools. Mayor Nutter is about to be honored by becoming the president of the U.S. Conference of Mayors, where we hope he will, among other things, encourage all the mayors in the country to promote healthier diets in every corner of their cities. So Mayor Nutter, would you come and join us? And just before you speak, I'd like to recognize your leadership in the health movement, and especially in Philadelphia, but an example for people around the country. And I'd like to present you with our Life Sweeter Champion Award, which it's made of, isn't this clever? Oh, yeah. It's made of special glass. It's a high-tech glass that detects calories. And if there's anything caloric in here, the glass dissolves. So drink up, drink hearty, and thank you so much for your work on these issues.
Oh, that's a little different. Good morning, everyone. It really is it's a great honor to have been asked to come to this first ever Soda Summit. And I want to thank certainly Dr. Jacobson, the great work that he's doing, the Center for Science in the Public Interest. Can we please give Dr. Jacobson a big round of applause? Thank you. I have a couple of my team members here, and again, on behalf of the City of Philadelphia, let me say thank you. One for the Center hosting this inaugural National Soda Summit, and given some of the things that we're doing in Philadelphia, thank you for this wonderful opportunity to talk about some of the things that we're doing, but also share additional ideas and perspective on the larger issues all across the United States of America. Dr. Malia is with us from the city's Department of Public Health. He's been a leader and champion and keeps me on the straight and narrow and very focused. He's our Director of Policy and Planning at the city's Department of Health, and please recognize him in his own right for his work. Doctor, thank you. And I'm also joined here today by Desiree Peterkin-Bell, my Director of Communications and Strategic Partnerships. We believe in active, regular communications. We'll be talking about these issues for some time, and also, of course, utilizing social media. If you'd like to follow, I'm at Michael_Nutter and we'll be sending out some information in the course of the day as well. I am not going to give you a full background, bio, all of that kind of stuff, but the very, very short version of who I am. I'm born, raised, educated, and created all my trouble in Philadelphia. I'm the 98th mayor of the city and was born and raised in West Philadelphia. I've dedicated my life to making Philadelphia a better city. Again, it is my hometown. I love that city. It has given me so much, and I owe so much back to the citizens of Philadelphia. And for me, that means that we would have a greener, cleaner, safer, and healthier city for all of us to enjoy, to live, work, and raise our families, and then pass on to our children and grandchildren a place better than we found it. I try. Some days it's difficult, but I try to live by example. I try to eat right, not always the easiest thing in the world. I was traveling not too long ago and allowed myself to be captured by a cinnamon bun early in the morning. That they may have been pumping that smell throughout the entire airport, but I found a place to get one. It just, but everything, of course, in moderation. Try to get into the gym on a regular basis. Some weeks are better than others. And again, I know as public health professionals, it really is more about moderation and portion size and those kinds of things than anything else. As an elected official, my approach to public health has been to try to be as inclusive, all-inclusive as possible. Public health is really about education. It's about public safety. It's about prevention. It's about intervention. And it's about sustainable green efforts as well. When I was a member of City Council, and Doctor, when you said that I had served 14 years, it almost sounds like I was doing a 10 to 15-year bid or something. So, but I served out. I loved City Council. I had a really great time and found it most intriguing. But I did host hearings on the issue of childhood obesity a number of years ago. And I saw this as a way of also trying to prevent or address adult obesity in Philadelphia, as 4 out of 5 overweight children grow up to be obese adults. As mayor, I've worked to make Philadelphia a more walkable and bikeable city. In 2008, I issued an executive order called the Complete Streets Executive Order, instructing all city agencies and departments to consider the needs of not just motorists, but also pedestrians and cyclists in our city as we design out Philadelphia, as we repave streets. And so we've included more and more bike lanes in Philadelphia, more bike racks, and we enjoy the distinction of having the most number of people of any big city in the country, the most number of people who actually bike to work. That's in Philadelphia. We have 20 new miles of bike lanes and a bike and pedestrian plan that encompasses the entire city. And not to mention, as discussed just a second ago, that's also helped to lead to more and more people biking to work in Philadelphia. I spent 6 years, 6 of the toughest, roughest, hardest years of my 14 and a half years in City Council, fighting to make Philadelphia a smoke-free city. 6 years, and face down big tobacco, face down, in some instances actually, the beverage industry, face down the naysayers, and still, in some instances, have the scars to show for it. I've said on a number of occasions that of all the things that I've had a chance to do as an elected official, and I've been fairly active, I think that making Philadelphia a smoke-free city is far and away the best thing that I ever did as a member of Philadelphia City Council. And I knew going into it that there would be these age-old arguments. The bar and restaurant industry adamantly against the smoking ban. Many citizens were opposed to it as well. It stalled twice in City Council, but eventually it did pass, and actually was one of the last bills that I voted on in June of 2006 before resigning from City Council to then announce that I was running for mayor. That action during that time and subsequent has led to 25,000 fewer people smoking in the city of Philadelphia, and certainly a whole lot more healthy citizens in our city. In Philadelphia, smoking-related complications are the leading cause of death. Diseases related to poor nutrition and physical inactivity are second, right behind smoking. I think the truth is pretty simple and pretty straightforward. Obesity is an epidemic. Over the last 3 decades, obesity rates have tripled. In America, 2/3 of adults and 1/3 of our children are now either overweight or obese. In Philadelphia, 2/3 of adults and 40% of children are overweight or obese. In some Philadelphia neighborhoods, more than half of the children are overweight or obese. African American children in Philadelphia have a 15% higher prevalence of obesity than white children in our city. Hispanic children are 25% more likely than white children to be overweight or obese. Nearly half of all African American adults in Philadelphia have high blood pressure, and 20% have diabetes. Nationally, obesity is responsible for an estimated $73 billion in lost productivity in the American workplace. And in Philadelphia alone, obesity leads to the loss of $1 billion annually in productivity for Philadelphia businesses. Let me talk a little bit about sugar-sweetened beverages. Sugar-sweetened beverages may not be solely responsible for obesity rates in America, but they are certainly part of the problem. And we can't deny that the two are connected, or as social scientists might say, correlated. Sugary drinks like soda, fruit drinks, and sweetened teas are the single largest source of sugar in the American diet. On average, Americans drink 20 ounces of soda a day. At 250 calories per 20-ounce soda, that means that the average American is drinking an extra 25 pounds a year in soda alone. When we were having our battles, and I'll talk a little bit more about this later on, one day I was out in someone's office, and I saw a 20-ounce bottle of Mountain Dew soda on a table. And we were having all these debates, and I started doing a lot of reading, and that's kind of how I get into my thing. And I looked at the back, and it had, the ounces and the serving size and the calories, and I noticed one thing, and I didn't really know what it meant. It said sugar. It said 73 grams. Now, I'm pretty good with, pints and quarts, and I know a little bit about cups and all that, but I never really fully, got into the grams thing. So I called Dr. Schwartz, he's our health commissioner, and I said, is there a formula that I could convert the grams to something that I'm much more familiar with? So he gave me the formula, and 73 grams is actually 2.56 ounces. And so I said, okay, well, what does that really mean? I have narrowed it down. So those, when you fly, and they say you can't take more than a container that holds 3 ounces of liquid? Well, it's 2.56 ounces. And so I got one of those containers and figured out what 2.56 ounces of sugar was, and it nearly fills a 3-ounce container. But for me to really make it clear what that is, I then realized that 2.56 ounces is actually 24 packets of sugar that if you were in a restaurant, they have the little containers and they have the little packets. So on my table in the center of my office, while all this debate was going on, I had a Mountain Dew soda, my little 3-ounce container that was nearly full, and 24 packets of sugar spread out on the table. And every person who came into my office during all this time that was going on, we ended up kind of talking about it because it was a fairly graphic example. Now, under what set of circumstances would you ever put 24 packs of sugar in anything that you would drink consciously? That's what we're talking about. And we know, especially with children, it's nothing for a kid to possibly have a couple of those a day. A Mountain Dew and a bag of potato chips is a breakfast of champions, almost, in some parts of our city. And so it really is about education. It's about information. Now, I don't personally have anything against soda. I mean, it is a completely, has no known nutritional value, is a virtually completely worthless product, but if that's what you want to do, that's your business. But people should at least know what all that data and what all that information means in real terms and in a way that they can fully understand. Philadelphians consume about 60 million gallons of sugar-sweetened beverages every year. That's half a liter per day per person. Children in Philadelphia drink 1 or 2 sugary drinks per day on average, with African American children consuming significantly more than white children. These facts clearly show a connection between sugar-sweetened beverages and weight gain. Sugary drinks, as I mentioned earlier, have no known nutritional value. They're completely empty calories that don't make you feel full. They may taste good, but it is certainly not good for you. Sugary drinks can even distort the taste preferences of children, making less sweet foods and beverages actually less appealing. The question is, who's responsible? The answer, of course, is far more complicated than that relatively straightforward question. Soda companies are not forcing average Americans to buy and drink massive quantities of their product. But the soda industry isn't being entirely honest with its customers either. Simply put, local, state, and our federal government, governmental agencies all across the country are fighting a tough battle against Big Soda. Big Soda has more money, more lobbyists, and more opportunities to turn people on to their product. How many commercials have you ever seen for Brussels sprouts? How many commercials for soda do you see? Not only are sugar-sweetened beverages cheap, but they are heavily marketed to kids and to people of color. The biggest spender on lobbyists in Philadelphia in the first quarter of this year was Big Soda. They outspent any other lobbying group by a factor of 6. And while their budgets continue to be large, of course, governmental budgets continue to shrink. Now, mayors, of course, function at the ground level. We're at the street level. We see our folks on a day-to-day basis. It is really up close and personal contact if you're a mayor. We live with our folks, we work with our folks, we shop with our folks. You might find this funny, we even go to the barbershop together. I go to the barbershop. I really do. And so my premise here is that local elected officials really are the best source of information, and the best individuals to be actively engaged in having a better sense of the community and what's going on and what can make their city, their region, a better place to live. And that's why mayors across the country, including myself, have proposed either taxes or new regulations on sugar-sweetened beverages. We need a multi-pronged approach to decrease sugar-sweetened beverage consumption. Education, taxation, and increased access to healthier options all have to be a part of the discussion. Now, just last week, my very good friend, neighbor to the north, Mayor Michael Bloomberg in New York, proposed a ban on sugary drinks larger than 16 ounces. And we're joined today, of course, by Commissioner of Public Health, Tom Farley. Can we give him and the mayor a big, big round of applause? Mayor Bloomberg has proposed to limit large sugary drinks being sold at food and service establishments like fast food restaurants, sports arenas, or delis. The ban wouldn't apply to diet sodas, fruit juices, dairy-based products, or beverages with no more than 25 calories per 8-ounce serving. It is a very bold strategy, and it is worth all of us evaluating and considering. Studies have shown that people eat what is served to them. And perhaps, if offered smaller portions, people would actually consume less. The problem, which Mayor Bloomberg has clearly noted, is that ridiculously large portions have become the new norm. 20 and 24-ounce sugary drink products are very, very common. In Richmond, California, they propose a 1 cent per ounce tax on sugar-sweetened beverages. In November, it will appear at the ballot box. The tax could influence the choices made by Richmond residents to pick healthier beverages. These legislative measures send a clear message to soda companies that government is placing a higher value on the health of our citizens. In my 2010 budget address, I also proposed a sugar-sweetened beverage tax of 2 cents per ounce for the first time. My hope was to impose that tax on retailers based on annual sales volume. We anticipated or estimated that the tax would generate about $77 million annually, which we could use to fund a concentrated health initiative geared towards battling obesity and overweight conditions. Part of the $77 million was going to our physical health, and the balance was going to our fiscal health. Keeping in mind that I had spent 6 years fighting to make Philadelphia a smoke-free city, I think folks probably had a sense that I was up for the fight and the battle. We came very close to passage. In 2011, the Philadelphia School District, facing a significant budget shortfall, I reintroduced the sugar-sweetened beverage proposal, same 2 cents per ounce, and this time it would be taxed on distributors, and we believe that it would help close a budget gap over at our school district. Each time we introduced a sugar-sweetened beverage tax, we faced determined opposition from the beverage industry. Our struggle centered on trying to garner public support and city council votes regarding the tax. Ultimately, we were not able to gather enough votes. The measures did not go forward and actually be voted upon because I thought the measures were too important to put them forward if we weren't sure about the votes. But there were some benefits nonetheless. We were able to significantly raise awareness about the connections between sugar-sweetened beverages and obesity. We created a dialogue about the tough choices that have to be made to protect the health of our children and adults and the productivity of our workforce. We also saw the very, very powerful interests. We're not going to sit back and allow their status quo to be threatened. Now, the soda industry has 3 main arguments against the enforcement of a sugar-sweetened beverage tax or other legislative matters. First, they argue that soda has not been conclusively connected to a rise in obesity rates. Interesting. But no one will argue that soda has a nutritional benefit or that the extra calories that sugar-sweetened beverages inject into the American diet turn into extra pounds over time. No one is willing to enter that debate. Second, sugar-sweetened beverage tax or large-serving soda ban negatively affects the personal liberties of low-income individuals. Now, the government is not trying to legislate individual preference or individual choice for soda or sugar-sweetened beverages, but instead, governments want to create and promote policies that encourage citizens to make conscious and well-informed decisions about the health impact of what they are buying for themselves, their families, or their children. And that is a part of government's responsibility. The purpose of increasing the price is not to gouge lower-income families. The purpose is to make people reconsider that particular cost and that particular choice as they consume whatever it is that they're going to consume and be informed of that decision-making before they do so. The third argument is that putting a soda tax into effect, as a result, people will consume less product, resulting in layoffs and job losses in the soda industry and increasing unemployment. Well, the thing about that argument is that delivery trucks are still going to need to send people out and deliver their products, and you're still going to need workers, and whether you're delivering 5,000 cases of soda, or 5,000 cases of water, or 5,000 cases of low sugar, no sugar products, or 100% fruit juice, no one is going to die of thirst in Philadelphia or any other city in the United States of America. So folks are going to be thirsty. The issue is, what are you drinking? And what is it doing to you? And so the whole job loss argument was nothing more than a scare tactic. Where do we go from here? Philadelphia's need for health initiatives that would address the staggering obesity rates remains a major issue and a major challenge. Also in 2010, the city received $15 million in funding from the Center for Disease Control and Prevention for over 2 years of work to reduce obesity by increasing physical activity and promoting healthy eating. With that funding, the Philadelphia Department of Public Health started the Get Healthy Philly initiative. It's a multi-sector initiative to address obesity through both policy and systems changes. And over the last 2 years, we've been able to accomplish a lot with our Get Healthy Philly program. Let me talk a little bit about that. We've created healthier schools in partnership with the school district. 171 of our schools are serving 100,000 students, have created wellness councils to put healthy policies into practice. More than 90 schools in our city have replaced candy bars with healthy foods. Schools have also implemented classroom movement breaks to get kids moving around during the course of the day. They shouldn't have to wait until their 30-minute, once a week gym class. We're also concentrating heavily on after-school programs as well. For the first time, food and fitness standards have been developed for 300 after-school programs affecting more than 20,000 low-income students. And through our Get Healthy Philly initiative, we've also encouraged people to decrease their consumption of unhealthy foods and beverages. And while we're making sure that adults, and certainly parents, understand the risks of high-calorie snacks and sugar-sweetened beverages both to themselves and to their children. Again, this is about education and information. We have a menu labeling law in Philadelphia. It's one of the strongest in the nation, and that provides critical information about calories, salt, fat, and carbs, again, to help folks make the healthy choice option. Nearly 40% of customers surveyed have said this information actually does lead them to make healthier food decisions. We have something called the Philly Food Bucks program, and that provides low-income Philadelphians with the opportunity to stretch their dollars a little longer. People who participate in the SNAP program, used to be called food stamps. We have more than 25 participating farmers markets across the city, and you can receive a $2 Philly Food Bucks coupon for every $5 that you spend. The Philly Food Bucks program has helped to increase SNAP redemption at farmers markets by 400%. And by leveraging federal dollars, we're also providing healthier and tastier meals to 3,000 kids every day in recreation centers through the USDA Supper program. Last summer, we served 2.8 million meals to approximately 90,000 young people across the city with our summer food service program. This program guarantees young people 18 years or younger will receive a nutritious breakfast, lunch, and snacks all during the course of the summer, and it's all for free. Get Healthy Philly is not only showing that there are a number of ways to combat obesity. Again, it's about information and education. We've also worked with other agencies and partnered to create the Fresh Food Financing Initiative. The Food Trust, the Reinvestment Fund, and the Urban Affairs Coalition partnered with the Commonwealth of Pennsylvania to bring supermarkets to low-income urban and rural communities all across Pennsylvania. We created a Healthy Corner Store network, providing incentives, training, and marketing support to 630 corner stores and refrigerated shelves in 100 stores, again, to incentivize them and encourage them to have fresh fruits and vegetables and other products right at a neighborhood store so the people didn't have to travel as far to go to the regular supermarket. Overall, the Fresh Food Financing Initiatives have provided funding for 88 fresh food retail projects in 34 Pennsylvania counties. That's about half of Pennsylvania. This has created or preserved 5,000 jobs and improved access to healthy food for more than 500,000 people. Philadelphia's also done some work specifically to address mass consumption of sugar-sweetened beverages. Since 1999, all public schools that serve primarily low-income families provide comprehensive nutrition information. Since 2004, the School District of Philadelphia banned the sale of all sodas and sugary drinks in school vending machines. Schools discontinued the use of fryers and switched to low-fat milk in 2009. We've made 260 vending machines, healthy vending machines, in our municipal buildings. We control those vending machines, we have contracts for them, and we can set standards for our own city vending machines, and we've made significant changes. Our vending machines offer more water and non-caloric drinks, put healthy options right at eye level, limit portion sizes of sugary drinks, and provide calorie labeling right on every machine. 8 other large employers in the city followed our lead, affecting the choices of 100,000 workers in Philadelphia. Lastly, as a part of our Get Healthy Philly program, we launched a mass media campaign to educate citizens about the links between sugary drinks, weight gain, and diabetes. This marketing campaign is primarily aimed at caregivers to help address obesity in young people and has been viewed more than 15 million times. Unfortunately, our original federal funding will soon run out. Did you notice that shameless plug for getting more federal funding? Luckily, many of our programs and policy changes have been implemented, that we've implemented, are sustainable without that particular funding source and will have a long-lasting impact on Philadelphia. But we are always looking for new funding opportunities. Moving forward, we've secured $7.5 million over a 5-year period of a grant from the CDC to continue our obesity reduction strategies. In conjunction with that grant, I've also committed $2 million of new funding for obesity prevention and tobacco control in the upcoming FY13 budget on behalf of the city. Let me conclude with these comments. In 1964, the Surgeon General of the United States released a report called Smoking and Health. And I always like it at this moment to make it a more intimate conversation when I start talking about these issues. That report outlined the health risks associated with smoking, and in the years since, apparently we're not going to have an intimate, and in the years since, we've learned more about smoking and secondhand smoke and the health risks associated with both. After 40 years of warnings about the dangers of smoking, many people were outraged when we decided to try to ban smoking in public buildings, city-owned facilities, outdoor areas, bars, and restaurants. Other cities have also enacted similar legislation, experiencing great pushback from the tobacco industry, certainly some in the restaurant and bar industry, and certain areas of the public. But years later, the numbers of new smokers is down, smoking rates are down, and the tobacco industry has not collapsed. Smokers may not have liked the regulations initially, but again, obviously, they learned to adjust and got on with their lives. We know the health risks associated with obesity: high blood pressure, heart disease, diabetes, and more. And that's why I'm calling for the same kind of report on sugar-sweetened beverages as the Surgeon General and the CDC undertook on tobacco. The time has come for a comprehensive study of what effects sugar-sweetened beverages have on our bodies. As a community, Philadelphia has a problem with obesity. From the statistics, so do many other American cities. I believe that sugar-sweetened beverages are a major contributor to the obesity problem in the United States of America. Luckily for us, it's actually a problem that we can do something about. Taxes play a role in adjusting consumer choices. Mayor Bloomberg's idea of a serving size ban could help reduce consumption. With either approach, one thing is very clear. We need more powerful and definitive scientific-based information that can explain with minimal doubt how we as a nation have gotten to this point. To what extent is diet responsible for obesity? What role does sugar-sweetened beverages play in that? How responsible is the often sedentary lifestyle that some of us may live? How involved is that in the issue of obesity as well? In the 19th and early 20th century, we were a nation that used our muscle to shape the landscape of our country, and we changed the world. Today, we are a nation stuck in a fight over healthcare costs and coverage, sometimes living inactive lives, and growing more overweight with every passing year. We have no idea how much the choices we are making will cost us. We have no idea what those costs will be to our children and to our grandchildren. But we need to act before it's too late. We need an honest conversation and a report, not rhetoric, on this issue. We need to focus on science, not scare tactics. We need our public officials to speak up on behalf of the health of their citizens and not be silenced by the empty threats of Big Soda and their lobbyists. The time for action is now, and you know as well as I do that our children listen to what we say and watch what we do. Let us all commit to do the right thing. Thank you very much.
That's wonderful. Do you have time for a question or two? It's really inspiring to hear a public official who really gets it. Mayor Nutter has time for one or two questions, if anybody has questions in the audience.
Yes, ma'am.
Hi, Mayor Nutter. My name is Sana Shahimi. I'm with Prevention Institute. We're based in Oakland, though I grew up in Philadelphia, so consider myself a Philly girl at heart always. I always say I'm from Philadelphia, even though I've been in California for 14 years now.
Keep saying that.
I'm not planning on stopping anytime soon.
Thank you.
I loved what you said about how to talk about the role and responsibility of government, and was just wondering if you could say a little bit more on how you do that as a government official, because as advocates, it's something we come up against all the time. Thank you.
Sure. I guess the first thing is, this business is not for the faint of heart, public service. But if you're going to run for a job like this, and whether it's mayor or a member of city council, state legislator, governor, member of Congress, you have to believe in something. You have to be committed to something. You should figure out a couple things that you're really willing to put a lot on the line for. And some days you're going to win, some days you're not. But some fights are worth fighting. I thought that about Smoke-Free Philly. That I could actually do something in that regard. And so, yeah, there were a lot of people who were really upset about that. We face the same with the battle on sugar-sweetened beverages. I think it really is about what are your core principles, what are your core values, what is it that you're trying to accomplish? Why did you get in public service in the first place? Well, I love people and I like to help out. I like to make things better. And, I've said on a couple occasions in different places, so I guess I'll say it here as well, that, there are some folks in this business who, I know go into it for the right reasons, and they do really want to help, but you can start to get caught up in kind of the trappings of it all. And that you're now more focused on how do I keep this job as opposed to doing my job. And so, I love the job, but I'm going to do my job. And some days, some people are going to be upset with me. And so what I say to that is, if you have a deep-seated need to be loved and admired on a daily basis, this is not the business for you. You should go work in a pet shop. Just believe in something and be willing to fight for it and take on those battles. And you'll have your naysayers. I'm sure somebody is complaining in Philly right now that it's too hot, it's too cold, the sun is too bright, it's, you didn't get your trash exactly on time. It just happens. That's what public service is really all about. But if you're a true public servant, then do what's right, and the rest will take care of itself. People were so upset in Philadelphia about the smoking ban. It was one of my last votes as a member of City Council. That was in June of 2006. 2 weeks later, I announced that I was leaving City Council. And the next month, I announced that I was running for mayor. And one of the things that people loved while I was running, which no one had any expectation that I was going to win, people kept talking about, oh, that's the guy that did the smoking ban. Oh, that's the guy that stood up for the citizens of this city. That's the guy that was really taking a risk and did the right thing. And it ended up being so positive. But if I was only worried about my own political future, I might not have done that because I knew that I was taking on great political risks. I mean, it wasn't maybe the smartest political strategy, but it was the right thing policy-wise. And I'm just trying to do the right thing. And I'm not perfect, and we make mistakes. Sure, I made one yesterday, probably made one this morning. I could be working on tomorrow's mistake right now. Who knows? You know, move on. So, you know, that's, I mean, that's my thing. I'm just trying to do my job. Any other questions? Yes, sir. Or yes, ma'am. Somebody. I don't think that's on.
I'll say it again. I'm Hank Cardella with the Hudson Institute.
Yeah.
I had a question for you. Obviously, we all care about reducing obesity rates. And secondly, as you pointed out, industry has resisted such proposals such as the soda tax. Has Philadelphia considered the opposite, almost a carrot approach, where you would consider structuring some kind of incentives to more aggressively get industry to lower the number of calories that they sell? Perhaps that might mitigate the resistance, and you might make more progress that way. I'd just like your thoughts.
So, I mean, to kind of tease that out, do you mean some kind of tax incentive or something like that, or?
Perhaps such as a tax, they already get tax deduction for all their marketing, so perhaps if they more aggressively lower the calories they sell, you might enhance the deductions they get, because that helps achieve the objectives of pulling the calories off the street. At the same time, it helps them manage their bottom lines and perhaps may generate a little less resistance to some of the
No. I've never thought about that. I mean, I hear the idea, and you know, from my perspective, though, I mean, that would be like offering incentives to the tobacco people. I mean, you have a product that we clearly know now kills people. So, and on the tobacco side, I'm not talking about sugar sweetened beverages. I think the industry needs to at least acknowledge that they are part of a problem. They have a scorched earth. It's not us. It's somebody else. How can you say that? You know, our thing is peace, love, and happiness, and people smile after they drink one of our sodas. There's no problem here, and I have a problem with that. So it's hard to have a serious conversation with folks who know that they are producing something that is at least a part of a problem. And I mean, and you know, right is right. I do see that on their own or to prevent further action, I'm seeing smaller containers on the shelves. I do see some action with regard to lower or almost no calories. I mean, I don't want to give anybody any advertising, but we've got all these new products out and everybody's going to zero. And then, of course, you have massive advertising campaigns that still get, the name out there while we're, trying to tell you that we have a zero calorie product. So, no, I never thought about some kind of incentive. I want them to acknowledge that they are a part of a growing problem in this country and to actively work to try to do something about it. That's what I'd like to see.
We better close up.
Okay.
Well, thank you so much, Mayor Nutter. You're a true inspiration. Thank you for participating.
Thank you.
And I'm sure Philadelphians appreciate so much what you're doing.
Some days. Thank you. Thank you very much.